introduce Chris Ebert, SVP and General Manager of Americas and EMA for Care Daily. Chris, would you like to introduce yourself and tell us about your company, Care Daily?
Yeah, sure. Wendy, thank you so much for inviting me to participate in your podcast today. I really appreciate it. Let me just briefly touch on my background and spend a few minutes and introduce Care Daily. So, throughout my career, my passion has really been about bringing new technology to market that changes life for the better. And so for the last 25 years, my focus has been in healthcare and technology and getting these innovative solutions to market across senior living, home health, home care, as well as internet-based services, whether they be internet-based services at home or wireless. And, for the last 10 years at Care Daily, I've, really dug in and been helping define and scale our AI-powered ambient OS caregiving platform and working with leading care providers, health systems, and strategic partners, not only in North America, but also Europe, such as the groundbreaking work we're doing with ADDOM in Belgium. So ADDOM is a federation or a consortium of 3 care federations. In the US, we would say care agency. They serve about 18,000 homes today. But this initiative, it was funded by Belgium and the EU to enable seniors to stay at home. And we're actively deploying 4,000 homes right now. And we were honored to be selected as their AI platform. And then this initiative is going to expand both in Belgium and to other countries where in Europe, much like the US, our population is aging and seniors want to stay at home.
Yeah, exactly. Very good. Well, as you know, baby boomers still make up the largest population of aging adults. What do you think the biggest need in their care is right now? And are we doing enough in our healthcare systems to support them?
Yeah, sure. And Wendy, would you like me to, that's a little bit about my background. Would you like me to tell you a little bit more about Care Daily?
Oh, sure. Yes.
Yeah. So, Care Daily is an impact company, and the software that we build is all about helping seniors and people with disabilities live independently. And what's unique about us is we unite the world's largest alliance of home-focused and age tech and health tech products to prioritize, who needs attention, family and clinical attention, predict declines, and deliver wellness solutions that enable these seniors to stay in their home.
Right.
So, we are, being a software or a SaaS company, what our real focus is delivering these cutting edge AI services that uniquely understand the physical world. So, and what we mean by that is all of our homes are different. So, my home, Wendy, is different than yours, and yours is different than one of your friends. And so it understands that physical world, and it's able to prioritize, predict, and prevent costly incidents. It's all about keeping seniors at home. Right. So that's the technology. Yeah. So that's the technology side. One of the things that really makes Care Daily unique is that this isn't just a technology solution. We have been supported with over $8 million in funding from the National Institute on Aging. And in fact, we're featured as one of their leading success stories.
Oh, wow.
So that it's been developed with extensive research. And we are literally the only technology scientifically proven to significantly reduce anxiety and improve sleep quality in caregivers of people with dementia and Alzheimer's, which is, one of the world's most expensive diseases. And it's through all this research that we've learned that it's not just about delivering technology, but you have to really think about the behavioral techniques and bringing family and multi-generational kids together, as well as friends, to care for not just the person who might be afflicted with dementia, but also that partner that needs help each and every day.
Yeah, very good. So going back to my question about the baby boomers, what do you think the biggest need is in their care right now? And do you think we're doing enough in our healthcare systems to support them?
Sure. You know what? Taking care and just like looking at that question, it's actually a really big question.
Okay.
And so I want to break it down in a couple different ways. So let's first of all talk about, there are kind of a few universal truths when you think about the baby boomers or seniors.
Right.
One is, well, whether you're getting your driver's license or filling out, an application, right? It's always, well, what's your age? But the truth is, not every senior is the same. Many older seniors can be younger, and many younger seniors can be much older. So, I've never been a big fan of that sort of, 0 to 18 and all of those little buckets that we try to put in. We're all different at each stage of our life. Another universal truth is that no matter whether you're in Europe, no matter whether you in the US, everyone wants to stay at home, wherever home may be. So it could be your home, or maybe it's you're in independent living. You want to stay there. You don't want to move on. You want to stay where you're comfortable. There's a third one. There's 4 of these that I'm going to highlight here. But what's really changing, and we see this a lot, even in just the last 5 years, that whether the senior or that baby boomer, technology is now part of their life.
Right.
And so they're used to being able to have a smartphone. If they move into a community, right, they're expecting to be able to stream their Netflix, and that's that's good, right? That's they're coming in familiar with technology as part of their life, and that's fabulous for keeping everyone healthier and happier. But we need to know how to use that technology. And then lastly, particularly in the senior care space, there's been sort of this, it's all about the adult child who's going to make decisions on having technology in the home for their senior loved one.
Right.
Well, what it turns out to be is, seniors want to help each other. They'd rather talk to their friend and get advice. Hey, what are you doing? How are you going to stay in your home? And so they turn to each other. And so, this ties into some of the academic research we've done, which is create the bonds between friends so they can help look after each other. It doesn't mean that they don't, respect their children's opinions, but they may not actually want them so much, or they may want them, but they're going to turn to their friends first rather than have their kids.
Yeah, very interesting.
Yeah. So, at the end of the day, it's all about, living for these seniors. It's all about living and experiencing the important moments and taking care of themselves. So, they don't have a fall that prevents them from seeing their grandchildren's graduation or getting married or celebrating a birth of a child.
Right.
So, so I mean, it all seems, obvious, but we don't always think about kind of those universal truths. So what can we do better to support them in the healthcare system? First of all, our healthcare system needs to reorientate itself to focus on enabling seniors to stay at home. And what this really means is that we kind of need to break the mold. Right now, our healthcare system isn't really thinking about the seniors at home. It's all today about addressing, a costly intervention. So, how to care for that person when they fell. And the reality of it is 80% of seniors who, have a fall or end up going to the emergency room, leave that hospital with no care. They get a sticker shock from trying to hire a referred care agency, or they get short-term support. And so it's a dilemma for seniors.
Yeah.
And so what the healthcare system needs to do is move faster. We need to embrace a model that's home-centric, that's proactive and predictive, and make that part of the health system. And this is a big change, Wendy. Our focus has been delivering the insights into the daily living patterns or activities, that can enable happier and healthier life. But today in the healthcare system, there's not reimbursement. There's some moves towards that, like for instance, with the GUIDE program, which focus on seniors with dementia that live at home. But a lot of it is on like point RPM or remote patient monitoring devices, like blood pressure cuffs. But, you can take your blood pressure reading or step on a scale. And after a while, people kind of get bored with that anyway. But, there's no context in the life being lived. And one that I've been working with, a couple nursing colleges, is that the reality of it is the training in the healthcare system doesn't factor in, well, what if I could understand how the person has been living and have scores like Care Daily produced to understand their overall wellness or their sleeping or mobility or bathroom or hygiene habits. There's no training for this. And so we've really got to think in the healthcare system, how do we bring up the next generation of healthcare workers that aren't just thinking about what happens when somebody goes to the hospital, but rather, what's happening before they get there.
Right.
And yeah. So, and then, there's another, and, I happen to grow up in Iowa, and this one I'm really passionate about, the rural settings. This is really important that we think about this and have solutions that understand how somebody's living at home, because in most cases, care is far away.
Right.
And, if a senior, there are seniors today who are really struggling thinking, gas is expensive. I think we all know about inflation.
Right.
Yeah. So do I spend the money to drive to my tertiary care center like I should, or do I forego that and stay at home? So, whether it's, and this goes beyond just having telehealth, Zoom or Teams session. This really is about understanding the patterns and complementing it with telehealth, but really understanding how that senior in the rural environment is living and heading off something that could be a costly care incident for them.
Yeah. So let's pivot a little bit and talk about the caregivers of the aging adults. Do you think there's enough attention to the needs of the caregivers? And caregivers here may be just someone that's making the medical decisions, or someone that's actually in the home with the senior.
Yeah. So, I mentioned earlier some of the work that we did with the NIA.
Right.
And that includes researchers from UC Berkeley, Johns Hopkins, and others. And, one of the things that our research told us is that there isn't and it hasn't been attention on the caregivers. And so we spent a lot of time in our work adding these behavioral techniques. There's really three goals. One is reducing the anxiety of that caregiver,
Right.
improving their sleep quality, and also, helping reduce depression. So we've done a pretty good job on the first two. So our solution, it actually functions, particularly in the anxiety space, like a non-drug therapeutic. And what I mean by that is that the active group was actually brought down below the point that they would qualify for anti-anxiety medication. Their sleep quality improved dramatically. And our studies are published. So if you want to go to caredaily.ai or look them up through the NIA or use your favorite search tool, these are published scientific results. And the reason this works is that we're able to deliver something that learns those unique patterns and actually feels like you've got another member of the family that's looking after things. You can reach out, it can coordinate conversations, and remind kids and family and friends, today is your day to call. So just simple things like, Wendy, today's your day to call grandma, right? And because we know what's going on, it will do clever little things. It's kind of gamified, but it'll say, hey, Wendy, she just got back home. Now's a good time to call. She's up, she's about. And, and then we'll reach back out and say, Wendy, did you talk to her? Yes. And then in one sentence, what should Chris talk to grandma about, or send her a picture? And then, each day it spreads that, and it can be just all via text. Nobody has to download an app. They sure can, but they don't have to. But we've had so many seniors say, I feel like my family's back together again.
Nice.
Yeah. The end of the week, rolls by and it's Sunday. And, if you're like most of us who grew up, Sunday was the day to call grandma. And it's like, planes backed up at the airport waiting, one call after another. But this daily interaction and some of these techniques that can help that caregiver feel like it's not all up to themselves.
Right.
And, so for us, the future of caregiving is intuitive, empathetic, and it's just always there, watching out for grandma, keeping everybody informed what to do, and also reminding everybody to stay in touch.
Right. Very good. Your solution, Ambient OS, is an AI solution designed to understand the living space and the environment of the aging patient and to predict and protect them from things like falls, as you mentioned. Can you walk us through your solution?
Yeah, sure. I'd be happy to. So, first of all, it starts with insights. And we've spent a lot of time pulling together the largest AI-powered health tech ecosystem. And what I mean by that is, there's a lot of really great point solutions out there, whether it's just ambient motion sensors, whether it's radar sensors for understanding falls, or radar sensors that can sit next to the bed and understand sleep patterns, or in the case of senior care facilities, smart diapers and the like. What we've done is we've pulled all of these different solutions together, along with data sources. Could be data from an EMR or an EHR. And the more data we get, the sharper the aperture on how that person is living. And what we do that's really special is, and by the way, I think we all know, there's always going to be a new device, particularly every year at CES in this space coming out. But we're able to give thoughts to these things in ways that the individual OEM of a point solution never thought of, because we can combine all of these insights. And, when we do that, then what we really do is unlock the insights and communicate it in a way that can result in precision in interventions. And what I mean by that is we work into the workflows of care teams and organizations, and have scores that we've developed over the years. So there's an overall wellness score. So you can quickly see across a population who needs attention, and prioritize that attention and why they need attention. You can drill down a little bit deeper and see the longitudinal trends of these different ADLs, such as, I think I mentioned them before, but things like sleep, mobility, stability, bathroom visits, showering, and hygiene, and even emotional and social scores. And that is all summarized in, this is a HIPAA, GDPR, CCPA compliant platform that combines not only the capability of a fully trained large action model that understands the physical world based on these device inputs, but also a HIPAA compliant, fully trained large language model. So we're all probably familiar with ChatGPT. This one is really designed for living spaces, and is able to summarize in a paragraph, as if a nurse wrote it, exactly how that person is doing. And particularly with seniors, a caregiver needs to know what's happened when they're not there, because 80% of the time, or 90%, they're not there, and anecdotal data just isn't enough. A senior,
Right.
And we've all dealt with our parents or grandparents on this, but they might be embarrassed, or maybe they don't remember how they got a bruise. This helps inform the conversations, and all of this information can be blended and put back into the EHR, so that you've got a sharper picture of how the person is doing. And then lastly, so if it's about bringing all these devices and data sources together, unlocking the interventions, providing the information where and when it needs to be, in terms of the care organizations looking after someone. The last part of it, and we touched on that quite a bit in your previous question, Wendy, but it's really about empowering families to actively participate in the care. So you end up with, data plus ambient assistance creates better outcomes and efficiency. The insights lower the costs and help deliver higher quality care. And this is all designed as a solution to be used across healthcare systems.
Yeah. So let me ask about ambient OS and how it takes care of the needs of the caregiver. You'd mentioned in what you just talked about the caregiver's role as monitoring the aging adult, but what about their own needs? Because we had talked a bit about, them having anxiety and depression and that type of thing.
Yeah. Well, sadly, and this actually, Wendy, that was a really good question about what needs to happen in the healthcare system,
right,
to take advantage of, or to help these baby boomers out. Caregivers have often left by the roadside,
right,
and it literally has, as I was just mentioning, it's all been about, and you can turn on the TV and there's probably 6 or 8 different, we can all remember the advertisements for 6 or 8 different age tech or health tech devices. But it really comes back to thinking about that caregiver. So I mentioned, we use techniques to reconnect multi-generational families and friends, right, but it kind of goes beyond just that. And what I mean by that is if once you get the family talking, it's about helping facilitate, little social circles or social networks, not having to go to Facebook or Instagram, I guess is big these days.
Right.
But, it's helping enable a family or friend to provide some relief. Like today, maybe it's dropping off food, or just being able to understand for that caregiver that, I'm going to swing by today. And this is some of the techniques we use, but I'm going to swing by today. And how would you like an hour or two off and go to the mall? Right. Or, get your nails done, or do anything, go for a walk, but just feel like, you're not just bound by this, but you've got a community of loved ones helping you.
Right. Right.
And then, the other thing is, and we're working with some of our partners on this, adding in a layer. So when, we're all caregivers or will be a caregiver, but, the challenge is when something happens, a senior falls, or maybe, they have been diagnosed with a chronic condition, all of a sudden life changes and you're not used to it, right? So we're working with some of our partners right now on care coordination services. So we know what's happening in the house, and that information can be used to automate things like understanding somebody's still at home and they should be going to the doctor. Do you want us to send an Uber for you?
Right.
Or, do you need your medication delivered? There's several of those life challenges that, the whole apple cart gets upset, that can help people stay at home and navigate when all of a sudden they become a caregiver.
Yeah, very good. So we had talked previously, and I know you just mentioned that your solution helps to identify insights, but one of the things that struck me was that you said it identifies things that both happen, but also things that don't happen. Can you explain why it's important to also identify the things that didn't happen?
Yeah, you know what? This is a really key point. And so, we learned environmental, behavioral, and living patterns. Again, I want to emphasize how important this is. This isn't a one size fits all. It literally learns each home uniquely by time of day, by day of week. And, there's wonderful partners of ours who can maybe, multiple ones that are focusing on being able to say something happened that shouldn't, like a fall. And of course, that's a big deal. It's super valuable to know someone's fallen and accelerate the response time. But because we understand the living patterns and the lifestyle, it's really the things that didn't happen that should have, that can really help keep someone at home longer. So let me give you a couple examples. Ambient sensors that learn the patterns of the person. We can understand if someone didn't come back home when they should have. So I'll give a couple examples. Actually, these scenarios happen in the same week.
Wow.
So we had somebody in one of our research studies, and on Tuesdays, she would take the bus one stop. I think we're all familiar with kind of the suburbs that kind of blended into a bigger city.
Right.
But they had raised their kids there. Her husband wasn't home. She had early onset dementia, and on Tuesdays she'd take the bus into town and buy some flowers. And this was the town they raised their kids for 30 years, and the system learned that. But what happened was she didn't come back home that Tuesday. And so it was smart enough, and we have these kind of customizable escalation procedures. But in this case, we set up a group text message. We alerted what we call the trusted circle. This is something we pioneered years ago based on our research. And everyone gets a text. It's like a instant group text that the AI participates in. And it's listening to make sure somebody says, hey, I got this. In this case, they're like, snap, it's Tuesday, she's on the bus. And they were able, fortunately, she got disorientated, she missed her stop, and they were able to find her on the other end of a big city in California. And she had missed her medications and take care of her.
Wow.
Another example, so that's something that didn't happen that should have, her not coming back home. And another one was simply mobility. So we look at and learn, someone's moving patterns around the home, from bedroom to living room to kitchen, which is like the command center of every home. And, without having a purse button, this particular individual's kids had given them the help I've fallen, I can't get up button, but it got tossed in the door because, he didn't feel like he was old enough to have to wear a button. Anyway, he didn't show up in the living room or the kitchen, but we understood he left his bedroom. So in this case, we created that group text. Our AI could understand. Nobody said, hey, I got this. So we dispatched an ambulance, and he had fallen down the stairs and seriously hurt himself.
Oh, wow.
And yeah, he would have been laying there for a while. And I'll just, there's many of these. I'll just give you a couple other ones. Sleep, as I mentioned, is really big. So if the sleeping patterns with, literally a few sensors, and within a week with 98% confidence level or higher, we can accurately predict when someone's going to wake up and go to bed. Okay. And if those, if they stop getting up like they normally did, that can indicate, either there's a medical condition, could be depression, and more. And, a related one to that is hygiene. If someone stops showering or bathing as normal, that's, another sign that someone needs to be checked on. And of course, we're also tracking bathroom habits and can do meals and medication and more. But it's these insights that, when used, can be predictive of something that could cause a costly intervention, and enable someone to take action, whether it's a caregiver or the family or friends or the caregiving organization, to just make people's lives better and not let something sit and simmer, and then all of a sudden the pot boils over and there's a care condition that nobody wants for the senior.
Yeah, exactly. Do you use EHR data to get better insights, and how is this data helpful?
Yeah, Wendy, great question. So right now, as I mentioned before, our primary focus is in senior care and IDD settings. And these settings could be, again, if it's someone's at home, it could be data from a home health company that's in their particular EMR, EHR, or the data that is entered in a senior care community setting, which is robust. It starts with simple things like ADTs is an acronym that just means admissions, discharge, or transfer. That helps who the person is. But beyond that, everything in a senior care community is in the EHR. And one thing that we've been able to show is we can actually, without the live understanding of the person's life, we've been able to ingest EHR data and accurately predict, based on what's in the EHR today, a fall up to 7 days in advance. But the real power here is, since this is a software platform, we're not a hardware manufacturer, the real power is using the ambient OS approach to combine the EHR data with the insights of how someone's living day to day with the client records. And when you can do that, the aperture is super sharp. So particularly in senior care communities, when we understand both how the person's doing and risk of falls, but could maybe say, for instance, add, what medications are they on?
Right.
When's the last time that, they had a tug test, which is, one of the tests to understand how well somebody moves, and
Right.
combine that with the insights from, whether it's in IL or AL or, whatever the setting in the community, then it really helps take care of that senior. In particular, everyone cares about falls. In senior care communities, it's a big deal if somebody falls. It's, expensive. It's, the person, the senior oftentimes when they fall may never be the same or start a downward path. And, for us, this is all about being able to prioritize, predict, and protect these seniors, their families, and the professionals who serve them from those kind of events. And then when I think, to the future, one of the things when we were talking earlier, you were asking me about is, what are the other use cases or healthcare organizations? And here we really see great value at with the payers or payviders, or there's a term, accountable care organization, which is kind of a combination of a payer and provider, where they assume the risk. All of this is bundled up in the industry under a term, value-based care, and that is all motivated about delivering better results, and that's exactly what we do. So we're able to demonstrate that we're keeping people at home healthier and longer and happier, and avoiding those costly events that lead to more expensive care.
Oh, very good. So Care Daily sounds like it's a great tool in the toolbox for physicians, caregivers, nursing homes, that type of thing, to help monitor aging adults. Are there any additions to the solution that they can look forward to?
Yeah, sure. So let me start with this, and this is the kind of the foundation from, the start of our conversation, and we should revisit it.
Okay.
So in working with one of the largest providers, she and the chief nursing officer, she said, what, Chris, Care Daily is really filling the missing gap in delivering proactive care. Because you're able to tell me the behavioral, environmental, and physical living patterns of the patient or resident. She said, we just don't get that. On one side, like let's say the left side of the spectrum, we have our EHR data, but that's only as good as, it's often historic as the last time that it was entered. And in some of these large providers, it's not one EHR. It could be up to 16. And some of them might even deliver the information via Excel. So she said, like, on this side, we've got a lot of good data. We're not really able to use it. And on the right side, for that person at home, there's RPM data. And we talked about that before. So that's remote patient monitoring, that's things like blood pressure cuffs and scales and the like. But even if the senior is keeping up with taking their measurements, that's only a point in time.
Right.
And, so looking ahead, what can you look forward for? I think it's really increasingly advanced insights.
Okay.
There's, as we've talked about, there's going to be new health tech and age tech devices.
Yeah.
There's going to be new data sources or complements to the EHR. We even look at things like meals and activities in a senior care setting. But I think the power of this is going to only keep increasing. It's fully trained today and learning more. and able to deliver a more robust or holistic understanding of the patient or resident to improve care.
Yeah.
But where do we go from here? I think there's two key areas. One is, while this model is been more focused on senior care and IDD, it has literally been designed like the Apple App Store, in that it's set up in a way that our partners and customers, and we're going to open it up to developers as well, to tune this for different chronic conditions. Yeah, it's really powerful. So if you think, what last decade of computing, what was the big thing? Well, it was the ability for developers to take, whether you're an Apple person or, Android person, opening up to developers, the camera and the gyrometer and, all the different capabilities, and create apps. And all of us have different apps on our phone. We've essentially designed our ambient OS to enable developers to get the information from these life patterns and repurpose it for all different chronic conditions. So it can be tuned, the scores that drive the prioritization of care, everything can be done based on, what is the condition. So we're really excited about branching beyond senior care and IDD to what it can do for any person at any age afflicted by some sort of chronic condition that requires understanding how they're living their life. So, I mentioned kind of the platform texting and doing things. The platform can communicate. And so we have a really innovative research project that has taken the questions, we've boiled them down. In some of our early research, the researchers were asking, several hundred questions, per month or per quarter. And these are scientific study questions to understand how somebody's physically or emotionally doing. Well, we kind of boiled those down. And in this study, we're literally reaching out, and it can, without having any devices, sometimes the best way to know how someone's doing is ask them. We can ask and see how they're doing. And the initial focus of this is being able to provide early identification of the, estimated to be 40% people have an undiagnosed dementia. So I think not only is there great stuff that's going to be coming and caring for people at home and across different chronic conditions, but I think there's great potential in population health too, to get ahead of the curve, before somebody ends up with a condition. If we can do that on a population level, that can have dramatic impacts for our healthcare system.
All right, very good. Well, I thank you so much for your time today, Chris. I really enjoyed our discussion on identifying living patterns in the home to help our aging population live longer. For more information about either Disrupt Health Tech or Care Daily, please see the links below. Thank you so much for attending today, and see you next episode.
Thank you.